Let's talk about disseminated idiopathic myofasciitis, also known as DIM. DIM is an autoimmune inflammatory condition in ferrets, once thought to be rare but has been seen more frequently in the past few years. It primarily targets the soft tissues and muscles in the body and occurs in ferrets most frequently under the age of 1 year old, but can be seen in ferrets up to 2 years of age. There is no confirmed cause for its development. An initial theory was that it was due to vaccines given to the ferret at a young age, but there is no supporting evidence for this. Clinical symptoms develop rapidly over 12 to 48 hours. Affected ferrets have multiple concurrent clinical signs, which most commonly include the following: a sudden high fever of 104 to 108 degrees Fahrenheit, acute loss of mobility, general weakness and severe lethargy, dehydration, serous nasal and ocular discharge, rapid heart rate and labored breathing, and pain signals may be observed when they're touched, primarily in the back end. DIM can only truly be diagnosed by muscle biopsy, but we have enough evidence now to rely on blood work alongside its distinct clinical presentation for enough confirmation when it is suspected. Here's an example from one of our 2 boys who was diagnosed and has since recovered. Key markers to note on this, which I have highlighted, include elevated neutrophil counts, which may present with left shift toxic changes, dull bodies and bands as the disease progresses, and anemia. Some common changes noted on chemistry include low albumin and a mildly raised ALT, but most other things remain within normal levels, including creatine kinase, which is very interesting considering the muscle degradation that comes with this disease. At the current time, DIM is regarded as being treatable, but the mortality rate is still high without swift intervention. Treatment requires chemotherapy and aggressive supportive care, including daily subcutaneous fluids, steroids, antibiotics to protect against secondary infection, appropriate pain management, and GI protectants. Hydrotherapy and massage have been proven to be beneficial for relieving muscle pains associated with the disease and aiding in repairing the muscle loss that occurs alongside it. The course of treatment for DIM is often long-term, with months of treatment and supportive care being required in many cases. Mocha and Hawk have been in full remission for nearly 2 years after closely following the treatment protocol. If you have any questions or suspect your ferret may be suffering from this disease, please leave a comment and I will answer to the best of my ability.